Good morning. This is Dr. Carlson talking from Honolulu, Hawaii, and God's wondrous paradise. I wanted to continue our conversation about the ill-advisability of implants and, of course, root canals we know already. The implant removal is something that's done very challengingly to people, especially after they've had them for a number of years. I'm going to report upon another case of a person that had severe pain upon chewing on the lower left side, tooth number 19, 18, and 20. And I'll show you those implants in just a moment, and we'll have this further discussion about this issue. The implants were placed about 5 to 5.5 years ago. She initially had quite a bit of difficulty in the healing phase, but was continued to be encouraged to keep her implants and weather the storm. I think they did a second surgery, adding some more bone and making some corrections, but this was on her lower left, replacing 3 teeth actually. The lower left second molar, which we call number 18, the lower left first molar, number 19, and the lower left second bicuspid, number 20. So what I'm going to do in this fifth presentation in the series of implant periimplantitis or implant infection removal, I wanted to go through her specific situation with visuals, which I think speak more fully to the issue so that you can see firsthand. So I'm going to step behind the camera and present certain slides or certain views, photographs that we have taken in the presentation of this series. Thank you so much. The first photograph, or actually representation of x-rays, is seen here. This is her lower left natural tooth we call tooth number 17. This is number 18, 19, and 20. You see a little bit of 21 over here. But the bone picture is quite grim in the sense that this is the crest of the alveolar bone. It tapers down here, and on the cheek side was eroded, although the integration looks pretty good, but she has some architectural changes around the implant here, down deep into the alveolar bone, and also the funneling here, which is classic of an implant that is in the stage of failure. This has been this way for some number of years. How long, I don't know. But the gum tissue came up along this area and was all inflamed, infected, and pus was coming out. She also has some other architectural changes along the bone here. The second x-ray shows a little bit different of an angle. This is some type of a erosion lesion. That's what they call a granuloma. So that's the radiographic picture of this 76-year-old female who had tremendous pain when she had bite on this whole region. She couldn't chew, and this had been for several months, or actually I think about a year prior to the removal. Upon our removal, what we did is sectioned each of these units, and as soon as these were cut apart, these were pretty stable. But this one was flapping in the breeze, and we didn't have any problem removing that. The other great concern about implants, especially the titanium, is the fact that they're made of metal. You can see the metal. This is looking from the top side of the biting surfaces. This is her lower vestibule. This is her lower lip. Her chin is actually out on this side. Her tongue is over on this side. She had the EMF, or the voltage, was 265 millivolts negative, and she had 15 microamperes that she was generating when we arced this implant to this implant. So she is having a tremendous amount of electrical activity. You can see the suppuration here, the white pus type formation, and again, not particularly reddened, a little bit here, but number 18 is mashed over in this area because of the lip. But that was the clinical picture. This is the post-surgical photograph. We have removed 20, 19, and 18. This is a gold crown she had back here and some type of a metal crown up in here. And when you check the electrical output, voltage-wise with the multimeter, you'll get incredible voltages, sometimes as high as 500 millivolts. And that's enough to cause a severe breakdown of normal tissue, especially with the microamperages. We took this material, which you see here. This is tooth number 18, or implant number 18, 19, and 20. This is the bone and soft tissue resected from the implant area. All of these were corroded, contrary to what they'll tell you. They won't corrode, but they were blackened. These are the crowns that fit on top of the posts, that once the posts have been done, they're stabilized and they will then form the biting surfaces. So here you can see we've cut these three apart and then removed them independently. All of that tissue was taken and sent to the Hawaii Pathologist Laboratory at the Queens Medical Center here in Honolulu. And I'll just read the microscopic description that you can probably see in this. I don't want to hold it too close. It says microscopic description. Section shows squamous mucosa with underlying granulation, fibrous tissue. Granulation tissue is a response to some type of a trauma or infection, and it's a normal tissue response attempting to dissolve the interfering products that are present in its area. Fibrous tissue is uncommon and should not be there in the bone, but it was. And marked acute and chronic inflammation, meaning that there was clear evidence due to the tissue descriptions microscopically that she had a severe infection in that area. The pathologist continues, bacterial colonies are noted. Usually this is actinomyces, although when we send the pathology tissues for inspection, we're not looking for the type of bacteria. But in about 1/3 of all these cases with implants and or root canals, you'll find bacteria colonies reminiscent of actinomyces, which is a kissing cousin of Candida and other pleomorphic bacteria and fungal type bacteria. The bone was viable, that's what they call it, but it's reactive. And reactive is a term of art in pathology that will confuse people because they think reactive doesn't mean much. At least I didn't think it meant much until I started doing some other reading about reactivity. Reactivity is a clinical sign from the bone marrow area showing severe changes in the hematopoietic tissue or the blood-forming tissue of the bone marrow. Normally bone marrow doesn't have any signs of challenges, but and I asked the pathologist, what exactly does that mean? It said basically the bone is reacting to some type of an injury or some type of a disturbance. And it could be electrical, but it also, and that's corrosion. Everything does corrode in the universe. And the implants are known to do that, although they'll say the zirconia is better. I'm not convinced of that because zirconia is a metal. It's not an electrical charged metal like the titanium, but it still carries an electrical moment to a certain degree. And these subtle factors can have a tremendous impact on the individual and their well-being, especially when you understand that tooth number 18, 19, and 20 sit on certain meridians according to Vole. Number 18 and 19 sit on the lung large intestine meridian, and number 20 sits on the stomach spleen, stomach pancreas meridian. These can be disturbed by those issues, those electrical discharges, theoretically in my mind, cause a disturbance. And this 76-year-old lady, she's like a samurai. She took the surgery without a flinch, and she must have done that also when they put the implants in about 5+ years ago. She recovered very nicely. We will be doing a removable partial denture for her, avoiding any kinds of other disturbances. So this is the report from Honolulu on the 5th in the series of implant infections and their removal. And I appreciate your tuning in with us, okay? We will talk to you in the future with other reports as we gain those. Thank you very much for your time and listening. God bless. Have a great day. Reporting from Honolulu, Hawaii. Thank you.